Hi. So today we're going to discuss our topic that we picked last week. What was it again?
I think it's terminology in medical translation, right?
Oh, yes. Okay. So as far as I know, medical terminology in translations actually converts healthcare related documents or information from one language to another, while preserving and precision and contextual integrity. So basically, it helps us as the netizen or the patients to understand the critical information in their own native language. Yeah.
But okay,
Am I
sorry to
correct?
interrupt you. Sorry.
Okay.
Uh, I actually want to ask you guys some question. Do you guys actually know what does terminology means?
No.
Oh, do you care to explain, Amni?
Yeah, sure. Okay. If I were to explain it, terminology itself means specific terms or words used in certain field. So right now, if you're talking about medical terminology, so that means words or terms used in medical. But also, I think it have another field like automotive field, social field. There's a lot of it, but right now, I'm gonna focus on medical, right? So
So
yeah.
basically, I mean, it's like medical field has their own vocab, right?
Yes, correct.
Okay.
From what I understand, right, terminology in medical field means that it is a universal language that allows the healthcare professionals, like the doctors, psychiatrists, and so on, to communicate
Mm-hmm.
effectively with each other. And it includes official terms and abbreviations that describe many things like diagnosis, diseases, treatments, and many other things.
Yes. Do you guys know who actually can use and relate with all this stuff?
I would say
This
doctors,
No,
nurses.
it can be used and understood between all healthcare actually. Between all healthcare professionals from various fields, including physician assistant, therapist,
Oh.
nutritionist, and surgeon,
Mm.
and many more.
Mm.
Interesting.
Interesting. Okay, but ca- as far as I know, I think there's a lot of types of terminologies in medical, right? There's I would say there's prefix and suffix, abbreviation. Maybe that's all. But okay, maybe you guys can mention you guys know any of it if you guys know.
Um, I think you know, as a drama watcher,
Hmm?
as a drama lover, I watch a lot of Korean drama, especially about the medical field. Do you know Resident Playbook or Hospital Playlist?
Yeah, I've heard of
yeah,
it.
Yeah,
I've heard of it.
those drama is about medical field. Um, they usually there are a few medical terms that they use. For example, scalpel. Scalpel is a tool that was used by the surgeon in the surgery room. Another example is stethoscope. Stethoscope is a device for listening to patient heartbeat.
Okay,
Mm.
what does scalpel do? What is a scalpel?
But it's a knife use, right?
Scalpel is a knife or blade that they use to cut patient skin in the surgery room.
Okay, so why they call a scalpel and not just a knife?
Because a knife is too general for them. Scalpel is much more easier. Um, I mean, I give you another example. Do you know um to to cut the patient's skin and to do more stuff, they use scissors. They use scissor in surgery. There are many different scissors they use. You know, such as Kelly scissor, Irish scissor, Goldman Fox scissor, and many more different type of scissor. Can you imagine if the surgeon asked for scissor to the nurse assistant? they be like, hand me the scissor. And the nurse might get confused and they don't know which kind of scissors the surgeon want. So with a specific term, it can help the surgery work better.
Mm.
Do you guys understand?
Yeah.
Yeah.
Yes.
I also have one example which is abbreviation. So do you guys know what BP stands for?
Is it a K-pop?
Oh,
No, Blackpink.
No, it's obviously not BP in medical, okay? So BP stands
Oh.
for blood pressure. So other
Whoa.
than that,
Darah
yeah,
tinggi.
yes, very good. So
Yeah.
other than that, do you? I think you guys actually have heard MRI, right?
oh
Yeah.
yes,
I've
yes.
Yeah,
heard
I
that.
know.
For
That might
scanning
But
something,
we
right?
never know what it means.
Yeah. So the MRI actually have a very long name. It means magnetic resonance imaging. So
Oh.
instead of saying the long full name, so the translator give us the short form, which is the abbreviation of it. So we call it MRI instead.
My eye. Oh.
Yeah.
Okay. That's interesting. Maybe another type of it, prefix suffix.
You know,
But
I was wondering, um, in medical field, do they also use prefix or suffix for their terminology?
well,
Yes.
maybe I can talk about it because okay, when we look at medical terminology, there are two common word parts that often come up. The suffix ology and also the prefix anti. So the suffix ology, are you guys familiar with it? Have you guys like heard
Oh,
of it
like
maybe?
biology.
Sociology.
Yes, yes. Yeah, actually, ology we is me we the meaning is study or science. So in medicine, it's used to name different fields of study or areas of specialization. Like for example, cardiology is the study of the heart. Neurology is the study of the nervous system, and who knows what is dermatology is?
Skin,
Um,
right?
Skin
Yes,
for our skin.
yes,
Oh,
always.
so is that why my skincare product has the dermatologist approved?
Yes, yes, because it means that lupa. Sorry.
It's okay. Are you okay, Dee?
Yes,
Yeah,
yes,
it's
yes, I'm
okay, it's
okay.
okay, it's okay.
it's
Oh my
okay.
god.
Yes, actually. Okay. So,
Is it cold?
dermatology is the
Hmm?
study of the skin. So
Hmm.
whenever we see a word ending in ology, it usually tells us what branch of medicine or science we're referring to. So on the other hand, the prefix anti means against or opposite of. It's actually from Greek. In medical terms, it used to describe something that works to fight or prevent a condition. For instance, antibiotics. What do you guys think it is?
Medicine?
Medicine.
Um,
Yes, it
Yes.
actually fights bacteria, while antivirus fight viruses and anticoagulants prevent blood from clotting. So anti is used to describe something that acts against disease or harmful processes. Both are really common and help make medical language clear and precise.
oh, I understand. Such an interesting info.
Yes.
I also know one.
Oh, okay.
I know one suffix example for medical terminology. It is okay. I don't know how to pronounce it, but okay. Do you have ever heard of meningitis, conjunctivitis, right?
Yeah.
So the ITIS it is a suffix actually. So the suffix means an inflammation or disease. So if the doctor say you have conjunctivitis, conjunct mean eye, so that means you have an eye disease. So another example
Oh,
would be gastroenteritis. So the itis means gastro means stomach and itis means disease. So you have a disease in your stomach, something like that.
Mm, interesting. Oh, I would like to add one more, but it's
Alright.
can you
Is
guys
it a
guess?
suffix?
Oh, it's not about the prefix or suffix, but
Oh,
can you guys
alright.
guess the similarity between Alzheimer's disease, Parkinson's disease, and Addison's disease?
No, just
No?
name
No.
of a disease.
All right. So
It's
all of these
illness.
diseases was named after the first person who discovered them. So so
Wait,
yeah.
sorry. So does it mean Alzheimer has Alzheimer before?
No.
No, he found it, right?
Yeah,
Not
he found the disease
Ah,
in
yes,
many of the
he
old
found
folks.
the
Oh,
disease.
Yeah, and he was the first
okay.
person to actually study the disease. So, the
ah,
disease of the brain condition that commonly found in old folks, it actually calls Alzheimer's. It was named after Alois Alzheimer's, but the actual person who found it did not have the disease. Um,
Oh,
yeah, and like
then
Oh,
yeah.
sorry.
that's
I thought
okay.
he forgot he had the disease and named the disease.
Maybe in the future, if you guys found a new disease, maybe you guys can name it after you guys. Maybe like Ahlam disease.
Wait, wait. So you're telling me like Parkinson is a human name?
Yes.
Yeah.
Wow, that's
These
pretty.
actually called eponyms. It means that it is a special term to describe something or a discovery that is named after the first person who discovered them. Oh, but actually, right. I
Oh.
think it 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 could be quite hard for normal people like us to remember
Yes.
this terminology, right? I think
Yeah.
that
Yes.
it
I
is
think
Mm.
it is quite important for us to know to know and learn the basic knowledge about this medical terminology. Do you
yes.
agree?
Yes. I
Yeah.
think it's a challenge to be an expert in medical terminology. Yeah, because it often includes complex and specialized and constant evolving terms. So as a translator, they must stay updated with the new terminology and understand regional differences in medical usage. Because do you guys know that actually in America they use the word surgery room, but in British they use operation theatre. Do you guys know
Oh,
that?
Oh
no, I did not
no,
know.
Yeah.
I thought it's just the same.
Yes.
Yeah.
So if the translator failed to do that, maybe some native speaker can be confused about it. So we can conclude that their role is to standardize a language that enables healthcare professionals to quickly and accurately assess a patient's need and communicate better with their care team, resulting in overall better patient outcomes, I think.
I
Mm.
bet the translator have a very hard time during the COVID era, the COVID
Oh, yeah.
19
Yeah.
era, because they need
Yes.
to be always stay updated about the
Yeah.
symptoms and
Yes,
everything,
To
right?
the new
yeah.
terms, right?
Yep.
Mm-hmm.
So maybe I don't know. Someone can. I think that's why terminology is important, right?
Mm. Yes.
Oh, yeah. So they actually have so many. They have many importance. They have many importance. Why
Mm-hmm.
terminology is important?
Many reasons why terminology is
Yeah,
important,
there are
right?
many
Yes,
reasons
yes.
why it is
All right, I
important. So
understand.
sorry. Okay.
All right, so
Okay.
you
So
give me the
first
first
of
one.
all,
Right.
okay. So the first important that I read is actually to ensure the patient safety. It prevent errors in diagnosis, treatments by ensuring that everyone involved in the patient case can understand the same exactly information, and also it's all about the people safety. Basically, that's because all a small or simple translation mistake can literally affect someone's treatment or even their life. Like, can you imagine if a
Mm.
cancer patient receive the wrong the
Medication.
wrong medical,
Mm.
would be very
Description, you mean?
insane.
Yeah, it will
Yeah.
be.
Hmm.
Yes, I agree with you, Julia. That is the importance of accuracy in medical field because it can convey life-saving information. Like you said before, a single mistranslated term can lead to serious consequences, such
Yes.
as like you said, wrong medication or wrong instruction or misdiagnosis. You know, there is a thing called hypertension and also hypotension. Do you know what hyper and hypo means?
That
No,
sounds
but
safe.
they
Is it the same
sound
thing?
so similar.
Yeah.
Yeah.
Yeah, they sound so similar, right? But hyper means something excessive, which is something that is extra. While hypo, it means insufficient, which means something that is low.
Mm.
So imagine someone that has this kind of illness, and the doctor or the pharmacist describe prescribe wrong medication for them. It can lead to serious consequences to the patient. That's why it is important for the medical field to have accuracy in their translation.
I think that's why, since Anis mentioned that, I think that's why medical terminology is used, because as you mentioned before, it's standardized a language, right? So when
Yep.
we have terminology, it's standardized a language for healthcare around the world. As you guys know, it's a global industry, right? Like every country has their own doctors.
Mm-mm.
So, when okay, I give example. If our doctors would go to another country to perform a surgery or maybe works there, so when we have the same language for medical terms, I would say is there's no problem, right? They can communicate with each other better, and also they
Mm-mm.
can understand better. So
Mm-mm.
also if that's why translation in medical also needed. So maybe just like you mentioned, operation theater. Sorry, what is that? Operation theater and surgery room, right? It can be
Yes.
different per country, but that's why we have a medical translation.
So
Also,
like basically,
yeah, yeah.
sorry. So like the basically what in Malaysia, we usually what we call the penyakit kuning, but the
Mm-hmm.
all over the doctors or all
All,
doctors call
all right.
penyakit kuning as what is it?
Jaundice.
Jaundice, right? Yeah,
Japanese.
Yeah.
jaundice.
So that's
Okay,
a
to
specific term.
prevent like misunderstanding, kan?
Understanding, yes.
Yes.
Also,
True.
I would like to add, okay, why translation is needed? Because it can promote clarity and precision by providing precise words and also phrases to describe condition and procedures. This clarity is vital because it can, as everyone mentioned earlier, is to prevent a misunderstanding that could happen, and also that can be avoided lah.
Also,
Mm.
did you guys know that medical translation also can help to expand medical information to patients from across the world? Like, not everyone speak the same language, right? So that
Mm-hmm.
Yep.
with the medical translation, we can make sure that each patient understand their diagnosis, treatments, and know what to do once they get home to take care of themselves. Also, I would like to add that it can also medical translation can also ensure patient satisfaction, because then when if the patients actually understand what they need to do and what they are getting what treatment they are getting done, they will feel respected because they receive the information in their native language. Mm, yeah, and like another thing is that the with medical translation, it can reduce legal and compliant risks. It means that those hospital sorry, it means that properly translated documents can actually protect hospitals from legal repercussions of miscommunications. It means that the hospitals can avoid lawsuit from their patients.
Mm. So like as Shaz mentioned earlier, so those professional in clinical medical fields such as doctors, surgeons, or maybe the
Nurse.
nurse, kan, specialists in
Mm-mm.
every hospital would obviously will learn the terminologies as they studied through their course, I mean their whole life. So
Yes.
what for those who are not who I mean us like
For
the
this,
netizens, how do we improve our terminology skills?
Well, from what I can say is for those in non-clinical such as healthcare informists, pharmacists and nutritionists, they also need to learn the terms. But for us as a citizen who are not in medical field, well, we need to learn it and at least have a basic knowledge in medical terminology, because obviously, like I say, we don't have any medical background and studies, right? So yeah, however, we need to study in terms to actually understand just a bit about medical term. But however, I feel like it might be hard. It might be hard as a normal people to understand and memorize because yeah. But I think there's a lot of medical translation. There's a lot of way that we can understand
Yes.
that maybe help us.
Yes, one of the medical translation that can help in my case is, you know that every patient will receive consent forms and also their medical records, like just how we go to doctors and they will give us our reports.
Mm-mm.
Okay,
Ah,
so that
yes.
reports and consent forms will be translated by a, you know, like a specific medical translator. So
Oh.
that's why, yeah, so that's why like the each patient will understand the risks and benefits of the treatments they are getting. Like it's not a space the in the consent form they will not use is hard terms that us as a citizen won't understand.
So patients fully understand the procedures or treatments they are actually agreeing to.
Yeah, agree. Sorry. Yes, that's correct. That's why you know translator must consider differences in healthcare terminology between countries. Like so, of course, in Malaysia we also have people from another country, right? So that's
Yes.
why they can translate it in English. So something like that. That's why translator is needed lah. I would say.
Also, other than that, usually, if you buy any medical devices, they will always provide the manual and instructions, right?
Mm.
For
Yes.
example, if you have a fever, you will buy a thermometer. So they will always how, you know how to use it, and what, and how to do lah. Yes. So
Yeah.
so also translator must be familiar with the regular expectation and the how the device functions. So it requires cross-disciplinary um, knowledge in both knowledge, okay, in engineering of how
And
the
also
device works and the medicine itself.
So
Yeah.
basically, like they need to know how the machine works, and also how the medicine how to use it. Like,
Yeah.
Yes.
You know, I have another application for, like, for example, when we had fever, we will go to the pharmacy, and the pharmacist will do the labeling and the packaging, right?
oh,
And
uh,
they will tell to consume the medicine before eating or like after eating, right? um they use a simple word for us, that is netizen, to understand it better, because if they use the correct medical term, it might lead to dosing error or side like different side effect that can give serious consequences to the patient, to us.
Also, that's why when I go to clinic, when they give me paracetamol, they usually write it as
Ubat demam.
fevers medicines, right?
Yes.
yes, like
Yeah.
what
But
demam,
Oh,
right?
so
demam.
that to make it easier for me. Oh, that's right.
Yeah.
I see. I see.
Um, do you guys know that every healthcare organization like hospital, clinic, they all share the same healthcare policies and protocols with all of their staffs so that they can encourage compliance and consistency across all the staff population. And these documents actually contains like technical and legal and procedural languages. Um, so that consistency can be maintained in this organization. Also, right, the translators are required to be fluent in both legal and medical terminology in terms of the healthcare policy document and that guidelines.
Mm. I think
Hmm.
it's such. Do you guys know DNR?
Oh, is it do not
Do not
resuscitate?
resuscitate.
Yeah.
Yeah, so that means I think all the if I'm not mistaken lah, I think all the doctors, hospitals need to follow that. So if the patient say DNR, so if they're going to
Yeah,
die,
yeah,
they can save the patient, right? So that's the same
yeah.
case, right?
Yeah, I think that's
So
it.
that's the
That's the same case.
protocol they need to follow.
Mm-mm.
That's interesting.
Yeah. So basically, I would say like medical translation for medical terminology is important, right?
Yeah,
Very
Yep.
important.
very important.
Very
Very.
challenging.
If there
at
wasn't
the
a
same time.
terminology, I think all of us need to be doctors.
Yeah.
I
All of us
agree.
must study.
Yes,
Must
really.
study the
Yeah.
Translation,
I
right?
bet
biology.
everyone needs to be a doctor somehow.
It's hard to be
Yep.
translator for this specific field, right?
Yeah.
Yep.
Yeah. Thank you everyone
Okay.
because I feel like I've gained a lot of
I
knowledge
think
today.
it
Mm-hmm.
was like a roller coaster ride. So many information today.
Because I think because we're not in this course, so like everything
Yep.
is new to us, right? And it's
Yeah.
interesting.
This is very fun. Okay.
Thank you, everyone.
It's good
All
to see
right.
everyone.
Thank you.
Bye.
Okay.
Bye bye.